This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com.
Hello, my name is Dr. Rob Page, and we are introducing this podcast of Doc Talks. Doc Talks is a podcast that's produced by the Knoxville Academy of Medicine, by its staff, and with its members. The members are physicians here in the Knoxville area who provide information to patients so that they can be better educated about how they make decisions and about how they can have additional information for how they can approach their own wellness. With me here today, I have Dr. I've forgotten already. Go ahead. You can tell me. Mariah Beasley. I remember Mariah. Now we can actually include that because this is good stuff. You know, this is actually human interest because now they won't forget your name. So Dr. Beasley is a general surgeon here in the Knoxville area.
Yes.
Who specializes in two areas. You specialize not only in bariatric surgery, but you also specialize in endocrine surgery,
Yes.
Particular types of endocrine surgery. But for now, we're going to talk about bariatric surgery.
Yes.
Tell us what bariatric surgery is.
Okay, so I like to start that off by first talking about the disease process that it's geared
Absolutely. What causes it? Why would I need to come see you as a bariatric surgeon?
Good deal. So obesity is becoming an increasing problem in the United States as well as other countries. But that is something that when we talk about the disease of obesity or the disorder of obesity, we know that there are a lot of health problems that come along with being overweight. And so there's some terminology that we use to kind of between doctors and health professionals to kind of gauge the amount of overweight or amount of increased fatty tissue that people have on them that contributes to these medical problems, and that's called BMI, body mass index. And so that is a gauge for us to speak. It's not perfect. There's bodybuilders that will prove that untrue as far as obesity, but it's a number that we use to gauge the amount of extra weight on someone. So when someone meets a certain criteria, when someone is either a BMI of 35 or greater with certain medical problems that are secondary to being overweight, or when someone has a BMI of 40 or greater, one of the tools that we have available, which is the most effective tool right now for weight loss, is bariatric surgery. So oftentimes patients have already tried multiple other tools such as diets. Some of them have tried weight loss medications, and so at some point, either on their own or from their primary care physician, they may be referred to us to just discuss metabolic or bariatric surgery. We also call it metabolic because there's a lot of hormone changes in there as well. So when I meet people, is kind of in their process of trying to use that as a tool to help with weight loss.
Gotcha. So we hear about obesity on the news all the time. Definitely becoming an epidemic in the United States. And you provide a tool by which patients can come see you and actually facilitate their weight loss. But this is not something that they should use just as weight loss. And so when you talk about these numbers, these BMIs, so what would that generally mean in terms of weight? If I were a male, roughly 6 feet tall, what would be the weight that you would think about to start performing bariatric surgery?
Right. So the way we calculate BMI is based on your weight versus your height. And so you'd have to give me a calculator as far as exact. But when you look at your weight versus your height,
Gotcha.
Someone who is 6 foot tall versus someone who's 5'2" have
Right.
very different weight expectations for a healthy weight. That answer your question?
Yes, it did.
Sorry.
Absolutely. So it wouldn't necessarily have to be a patient, because I think what most people know about in terms of bariatric surgery is the show that's on TV now, My 600-Pound Life.
Yes.
So we're talking about those are patients who are in the extreme end of the spectrum. Not necessarily have to be that extreme, but just be someone who's considered to be obese. Or severe, or is there now? There's obese or
Yes, there is obesity, or overweight, which is over a BMI over 25.
Right.
There is obesity, which is over the BMI of 30, and
Okay.
then there is morbid obesity over
Morbid obesity.
40. So,
yeah, gotcha.
And those are terms that are don't always have bad connotation, but it's basically looking at the amount of excess weight and how someone carries it. I mean, everyone, as far as genetics, we'll get into that too. When you spoke about, what are the other, this is not just the only thing, you don't give the surgery, there's a whole spectrum of things that we discuss, because it is just a tool to help them get where they want to be. So when they come see us, we're not a drive-through surgery that says, here's your surgery, good luck, and then that's magic and fixes their problem. We go through, basically the way I explain it to people is it's very complex, and that's one problem with obesity, is that it has a stigma to it that's not very good, and it makes it hard to speak to patients. It's hard for primary care docs to speak to their patients, hard for patients to speak to their primary care docs, but it comes with a stigma. But what we know is that it's very complex. So it's not just I just eat too much, it's all a behavioral issue.
Right.
We know
there's a large psychological aspect of it as well. Yeah.
That genetics, we know there's many genes that the way I think about it is a genetic predisposition. So the same way as you have genetic predisposition to get high blood pressure or to get early heart disease, there's some families that every male in their family, by the time they're 50, they have heart disease. So the way I think of it is a genetic predisposition. And what I tell my patients with surgery is our goal is to educate you on your nutrition, increasing activity, which the majority is from what we take in or what our body does with it. Exercise, which is great for every aspect of our body, is not the biggest component of weight loss. But we educate them on those things, so that what I tell them is the goal of the surgery is to get you down to a certain weight, help you reset your body, so that once you get down, then you're able to maintain that weight loss through all the tools we've given you, which include education. I tell them, we don't change your genetics. So we're putting you in, we basically help your body get down to a lower weight, but your genetics don't change. So to be most successful and to maintain that weight loss requires remembering that you have this genetic predisposition to the disease.
So you basically, so as a patient, you wouldn't just necessarily come in and say, okay, you have this certain BMI, you need the surgery. You would generally need to expect them to start weight loss first, to start altering behaviors that maybe have led to their obesity, increase activity levels, maybe change diet. It's just sort of an entire integrative approach to how they would approach their own weight loss.
Yes.
So, yes. Well, now let's say I'm a patient and I have a BMI of 35 or a BMI of 40. And I'm a candidate. How would I go about seeing you? What would I need to do first before I come see you as a patient?
Okay, so a lot of times we have two different sets, either patients who come on their own, and we're welcome to see people who don't have referrals. It's just patients reach out to us.
So I wouldn't necessarily need to have my primary care doctor or anybody else, sign something that I need to come to you.
We don't have, no,
Okay.
but we will require you to see your primary care doctor at some point in the process.
Gotcha.
Absolutely, we get them involved.
To make sure that you're maintaining your health and doing other things.
Absolutely,
Yeah, so.
Absolutely. And a lot of the insurances require that however many months of medically supervised weight loss. And so that is required through either primary care doc.
But this is something that's covered by insurance under certain circumstances? Or
Most insurances, but that is something that we do have to look into individual insurances. It gets very complicated, as you know.
Insurance complicated,
yeah.
yes.
So that is something that we help guide the patients through the process.
Gotcha. So you've seen a patient, and let's say you're a candidate for surgery, you've gotten approved by your insurance, you have the surgery. How long is the general downtime for a patient who's had this form of surgery?
I would say average of about 2 weeks off of work. It can be 2 to 4 weeks. And so that depends on, obviously, each individual undergoing each surgery can have different post-operative symptoms are slower, and others are up and are ready to go within a week. So it just kind of depends, but I would say average of about 2 weeks.
So after those 2 weeks, would I be able just to resume activities as normal? Would I be able to eat however I wanted to, or would I generally need to? Yeah, you know where I'm going with this.
Yes,
So.
Absolutely, absolutely. We view this as a long-term relationship with our patients, and so we have a very regimented phase of progression with the diet. And so when I say diet, we again try to say lifestyle changes,
Gotcha.
Different way of thinking about food. And so we have a very set progression of that diet. And so they will come with us, we'll advance their food choices over the next several months. And then we continue to see them for, again, education throughout we'll see them as long as they're willing to come in, because we do view obesity as a chronic disease and something that can, we have seen some weight regain, although that's not a very high percentage, but we can see that. And so we view it as we want them to be comfortable if they start seeing an increase in weight to come back in.
So this is not a cure-all. This is not something that if I just have the surgery, I'm cured forever and I don't have to worry about it. I would actually need to make sure and integrate all parts of my lifestyle into basically making sure that it's a success.
Absolutely. So the way we, again, look at it is when someone has obesity, we view it as the body has almost reset its set point at a higher weight. So in saying that, the body doesn't help the patients lose the weight once it gets to a certain point. And so our goal is to help patients get down to a lower weight so their body can function more normally.
Almost like jump-starting their metabolism and making sure that they can actually start. Their body just sort of resets itself. It's not just accustomed to carrying all this weight and taking in all the calories, that you're actually sort of jump-starting it before you have the surgery, and so you actually have gotten sort of a running start, so to speak.
That and just the baseline. I'm not sure if you followed The Biggest Loser as well.
Oh, yeah.
And so they, with them, what they found was even when they had all the weight loss, of course they were working nonstop with personal chefs, but they lost all this weight, and then they followed them up long term, and obviously you're going to see a variety of how they did post-operatively. But what they found with a lot of patients is that they would follow them up, and even though they were doing really good on their calorie intake, and as well as going to the gym 5 times a week, they couldn't do what they were doing in the show.
Right.
Obviously, that's not sustainable. But what they found is their metabolism just shut down, slowed down, and so they actually started regaining the weight, even though by our terms we would say they're doing really good with their choices. But what we found was, again, their body was not. Again, at that set point, it's almost as if their body was fighting to get back to
Right,
that.
because you're almost like in a starvation mode, right? And so the body basically just starts to conserve calories as much as it can, because you basically haven't eaten anything for weeks, right? So, and you don't want to do that. You want to make sure that that starvation diet's a bad thing. You want to make sure that you gradually decrease your number of calories over time to make sure, just as you said, that you don't, alter your metabolism to a point where your body is trying to conserve as many calories as possible. So excellent. So I'm a patient. I've come in. I've had the surgery. I've followed up as a patient. What are some overall healthy lifestyle choices that you think basically patients should use? Even in the advent. We know obesity has become an epidemic in this country. What are good recommendations that you would suggest to patients who are concerned about their weight? And what sort of lifestyle changes or what sort of modifications should they make so that they, even if they are genetically predisposed, that they can actually help avoid this problem?
Absolutely. So it all comes down to the basics, the things I think we all know, but is harder to do in this environment where there's an excess of unhealthy and fast foods, and people who, what's cheapest and easiest to get is the worst for us. And so it all comes down to the basics of fresh veggies, fresh fruits and vegetables, and lean meats, and trying to have an active lifestyle. When I say active, again, that can be seen in a variety of different extremes, but just being more active, because that's our environment right now. A lot of the foods are playing a part into this epidemic. And so it's trying to rethink the way we view food and the types of foods, and just being educated, because a lot of things marketed now are marketed as healthy, and they're still full of things that are unhealthy.
Because something like gluten-free, we look at it and we say, oh, it's gluten-free, it must be healthy. That doesn't mean it's healthy. And even some things that never have even had gluten in them are advertised as gluten-free. Like shampoo
Yes, and there's been some small studies looking at, and I think we all know processed foods versus non-processed, and calories are not created equal anymore.
A processed food is generally something that basically has been. The way I look at it, it's prepackaged.
Yes.
It's come in something that basically has been manufactured by a company.
Yes.
It already has all the ingredients in it.
Yes.
It's not something like a steak or vegetables or something along those lines where you actually see the individual parts of it. Right?
yes. And also, the way I also think of it is when we talk about processed, when we talk about calories are not created equal, if we eat something, our bodies are actually designed that we eat something and our body actually utilizes energy to break it down. And when you eat processed foods, the thought is your body, it's a very different process, and so it throws again that metabolic.
It's already pretty much broken down. I mean, so you're not burning as many calories just by eating it, I guess. Yeah.
And that metabolic dysregulation already, again, dysregulation of that as far as how we store fat results in obesity. So.
Excellent. Well, you've given us a lot of good information today about obesity and about bariatric surgery. Is there anything else you'd like to add that you think is of importance that patients should know about this?
Again, to me, the biggest thing is just being open to talking about it. Again, it comes with that bias. You know, I hear so many patients say, I really feel like I'm doing everything I can, and, you know, really there are a very diverse situations that patients find themselves in where they truly are trying, and their metabolism, again, is just their body's, the way I tell them is your body's just not helping you out. Now, when we nitpick through, we all have areas we can work on, right? So there's definitely things that every individual, whether you struggle with weight loss or not, that you can work on. So just knowing that it's not something that that people should come for help and not be ashamed of, that there is, you know, other things that we can help improve that.
So avoid the stigma. I mean, it's just basically, you know, the concept of obesity. I mean, it's not, you know, there's a lot of different connotations to it. It's lazy. It's, you know, you basically, I mean, it's just, so that's not, so basically to avoid the stigma, the fact that it's such a negatively used term, like you mentioned, morbid obesity. I mean, you know, obesity is associated with death. I mean, that, I don't think anything's much more negative than that, is it? So,
Absolutely.
So anyway, well, Dr. Mariah Beasley, thank you so very much for joining me here today. Can you give the patients some information about your office and maybe where it's located, if you have a website where they can maybe get additional information, and your phone number?
Yes.
It'll appear at the bottom of the screen.
Very good.
It'll appear at the bottom of the screen.
I am located at Turkey Creek Medical Center. Edit that in.
Okay, so it's so your address. That's right.
Yes.
So that'll all appear on the screen, and that's
Perfect.
perfectly fine. So
That's
anyway,
perfect.
but you know, in this era, nobody knows their phone numbers anymore, do they?
Isn't
I
that
mean,
terrible?
it's all pre-programmed into phones. You wouldn't have any idea. It used to be a great skill of mine that I remember people's phone numbers, and now I can't remember anything. So I've replaced that part of my brain. Well, thank you so very much for joining us here today and giving us a lot of information about obesity and about bariatric surgery. And with that, this concludes this podcast of Doc Talks. Doc Talks is a series that's produced by the Knoxville Academy of Medicine by its staff and utilizing its members to provide patients with information about topics that are of importance to them. Again, I'd like to thank you for joining us here today, and have a wonderful day.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com.